Hello, my name is Joni Edelman, and this is my recording of my leadership video. So, at this point in my journey, the first question is the why of what I'm doing? Is it the same when I've started? And to elaborate about my project and how I came to that idea and how it's changed. So, my overall goal is the same after the last 2 semesters in getting our proposals together. But the process has required me to narrow my research question to a more specific outcome. The idea for this project started in 2015 following some water testing results that occurred at the daycare where I'm the nurse health consultant. Crete is one of the last mining silver boom towns in Colorado with the initial strike in 1892. And mining was done almost for 100 years until the mine closed in 1985. So at this point, we have the Nelson Tunnel. That's an active Superfund site that discharges mine drainage into West Willow Creek that joins East Willow Creek, which is what is called the Flume, and it's a creek that runs through town, and then it drains into the headwaters of the Rio Grande. We know from EPA and reclamation efforts and testing that the Superfund site has high levels of lead, cadmium, and zinc. And some of the initial testing that was done with the Willow Creek Reclamation Project in the early 2000s actually had over 400 parts per million of lead in the soil where the testing and reclamation was done. So I started with this panorama view of wanting to look at lead screening and is this a risk or a need in Crete, and also to see if there's any correlations or patterns with lead level as far as who has high level, where do they live, is it a part of town, is it a family, is it a particular age of home, and looking at those risk factors. So this project has been in my mind for a while. And through that time, I was able to get grants. I was able to purchase a Magellan lead capillary testing machine. And then I feel like life kind of things changed. COVID happened. And so this has kind of gotten put on the back burner. And so I'm excited about this opportunity to bring this idea to bring lead testing, which is a recommended early childhood screening that has not occurred ever in this county. And I've been here for the last 15 years. And so with that, my evaluation question is specifically now looking at the process of screening kids that are between the particular ages of 12 to 72 months. And do we have detectable lead levels? Do we not? But my overall question is, it's more of instead of a program evaluation, a program implementation, but I will be evaluating that and figuring out is what's the best way for us to increase our testing rate for lead. And then with those results, this will help guide me to further develop my work in the community and how we continue lead testing. Our second question is, what do you need to change in yourself or leave behind? Looking at feedback from our environment, looking at approaches, biases, and skills. And do I have insight into that right now? I feel like through this process, I am a little bit frustrated by the narrow angle of research and the delays in starting the program. I've always seen myself as the one that's doing the work, not so much the planning. In the public health district where I live and work, I do the screenings, I do the shots, I give the education. And while I'm not discounting the value of research and firmly support evidence-based care, it's hard for me to spend the time to plan in such intricate detail programs, because when it's just me, I often have, I get it done. I feel like using that PDSA process, that's something I do all the time of what worked, didn't work, how can I do it better next time? Of the 100 COVID vaccine clinics I did, from our pod, our point of distribution, to drive-through clinics of what worked, what didn't. And so each week, tweaking it to make it better, make it more efficient, changing how we were having people waiting, how we had timers. And so that logistical planning, as far as, that I feel like is a skill of mine, but the details this proposal has required has been frustrating and hard for me. I realize how much my public health director compensates for some of my lack of attention to details, as she usually handles kind of the contracts and the budgets for the big ideas while I'm doing them. A recent example of this, not related to our project, is getting an electronic health record for our office. So I've researched the options that support public health functions, completed demos with different companies, reviewed billing and credentialing services, and I've done a lot of that legwork, while Tara is negotiating the contracts and arranging the financial payments and conducting licensing reviews. And while this partnership works for us, I can understand how this enables me to just do the parts that I like, which makes me very fortunate in the place that I work and my job, that I do get to do every day things that I love to do. What is my leadership vision for the project at this time, and where do I see it going, as well as anticipating the main roles and how am I best going to facilitate this? So sharing, like I said before, I am the only public health nurse in the public health district, and actually only like one of 3 nurses in the entire county. And so I will spearhead this project, and I will be completing the entire process myself. I still have community partners like the director of the Early Learning Center that will provide a platform for my research, and they'll be very important partners and key stakeholders. Part of my project is also to share my results with the other public health offices in the San Luis Valley, and I hope that this will help those offices plan to implement lead testing programs as well, because we know this is a deficit in our area. So if I can plan a how to do this, I'm hoping it'll make that easier for other departments to pick up this program, even though none of us have enough resources. The Gantt project or assignment did help me kind of itemize the to-dos and making those monthly plans of the part of the project that will be implemented and when, and creating my educational outreaches. And I already have a lot of my initial proponents set up, as I'll be at the Back to School Night Discovery Night for the K-12 and here in a couple weeks, as well as the Back to School Evenings at the Early Learning Center. And so I'll be presenting about providing lead testing, doing my initial education outreach, and doing my initial collection of data from families. Last question is to maximize my strengths, and what are my strengths and how can I use those in my project site at this point? I would describe myself as a master at multitasking, but I'm often so busy and have to procrastinate on things that I don't want to do or that require an intensive period of time. I think this can be considered a strength and a weakness, but the only period of 2 to 3 hours that I can work on homework or on project work is late at night after the kids go to bed. Often I'm trying to work, 10 to midnight or 10 to 1, or if I can drag myself out of bed before the kids wake up and do, like 5 to 6 or 5 to 7. But I am motivated to graduate in May of 2024, and I just feel like I've got to keep it together for 2 more semesters. I have learned to delegate more life tasks like laundry and dishes to my husband, lowering my expectations for a clean house, and trying to be more productive when I do work. I feel fortunate that I do have a supportive crew with our public health district, and that my coworkers are also my friends and see me and support me going through this process of earning my degree. One big thing that I feel like I can influence so that this major improvement can take place is to be flexible. I have to plan on how to implement my research, but I also know from prior projects and having been in this role since 2013, is that I need to be able to alter an action, address an unintended consequence quickly, as is going to more likely lead to success. Deliberately using kind of the plan review process and documenting adjustments will also help improve how we do other programs, and I'm hoping to be able to share that with other public health offices that are implemented here in the Silver Thread Public Health District, as well as in the San Luis Valley. Thank you for your time.